When I gave birth to my first child, I realized he had a H-borne disease. Now, this is the reason why he had the H-borne disease. I'm going to be talking about what to do while pregnant to avoid the H-borne disease, what not to do, causes of H-borne disease. Now, he's 4 years old, he can't talk, he can't walk. H-borne disease is not a life-threatening disease. It's not supposed to lead to him not talking or him not walking. But there is something that happened that made his own so severe. I'll still talk about it. 90% to 95% of children, especially baby boys, being given birth to, always come out with that H-borne disease. Some parents don't even know that their children have H-borne disease. Some do know, depending on how severe the problem is. Okay, in H-borne disease, it's just a case where the annulus, there is a electrode something that's supposed to form on the annulus. So sometimes they have short H-borne, they have long one. So it depending on the one you have. So if the electrolytes did not form completely, it will lead to H-borne disease. Now, how do you know that your child has H-borne disease? When your child has H-borne disease, according to what happened to my child, when he came out the first time, he did not pass 2. Yes, he was supposed, when a child is coming out, once you push out your child, the first thing the child does is to cry and pass out that stool. They called I've forgotten the name of this stool, but their first stool, it's packed with so much black stuff. That's why when your labor progresses so long, the child might pass this stool in your stomach, and when they pass this stool in the stomach and swallow it again, that's one of the reasons. Lately, you give birth to your baby, you realize your baby died, right? So when I gave birth to my baby in 2021, I realized my baby did not pass out that stool, but I didn't know. I did not ask the question because I was battling with my own life. So it was when I was okay, I came out, I was asking them. They said the baby is not eating that much, the baby. And another thing, the hospital I used contributed to his problem. Because in some cases, why I say some women don't know that their children have that disease is when maybe your child did not pass out that stool. There's a way all those midwives, they used to do it manually to help the child pass out this stool, right? So this hospital did not do it, and they did not tell me. A day have passed, second day have passed. I realized my child was not eating. And what is the problem? They said, oh, that there's no problem. Don't worry, with time he will still start eating. I asked them, did he pass out stool? Because I called our family nurse. He said I should ask them this question. They said, yes, he passed out that stool. Do you know, on the 3rd day it was getting worse, and they said they were going to call, because in that hospital they don't have all these doctors for children, right? They said they were going to call one for me, and this is 3rd day, they've not called, and this child is not eating, and this child is just dying. The next thing we would have heard that this child just died like that. Anyways, fast forward to when my husband took action. Have to call the MD of the hospital, threaten the MD, call these people or I will sue you. Anyways, at the end of the day, because of the threats, they were able to call the MD of the hospital. The MD of the hospital was able to call the doctor, the particular doctor that is supposed to look at the child. When the doctor came, the doctor looked at the child and said, okay, we need to run some tests, we need to go for this, so we went for scan, and we went, and it was already an emergency. We had to go with ambulance. At this point, he's at the verge of dying, like it was already 50-50, so we had to go with ambulance to fasten it up. When we went for the scan, they said, okay, he has a blockage of the Bluetooth blockage. Like, there are so many English. So when we came back, they said, oh, this hospital, they can't do anything. They recommended us to 2 hospitals, of which we took one, which is at Lekki. We went to the hospital. Thank God we went through emergency. Immediately we went, they had to the first thing the doctor did was to insert his hand, and if you see the kind of poo that came out, oh my God. If you see the kind of poo that came out, that means this is what has been blocking this child's body. And before then, when we got to the hospital, we noticed his stomach was already swollen with plenty of what they call it, veins, with plenty of veins all around his stomach. When your stomach is extremely swollen. So immediately the doctor did that, the stomach went down and all that. Now, here is where we made a mistake. Normally, some children that have H-borne disease, they grow with it without even realizing. Yes, that's the only problem you'll be having, is having difficulty in stooling, but you will grow normally. So when the doctor did this, it was already fine. We went to the doctor, we said, okay, now that he can poo, because after then he was able to poo on his own, what do we do? This doctor told us that we need to do surgery. We were like, I'll do surgery. Why? But the baby is fine. He said, if we don't do surgery, and this doctor told us we need to even do it as fast as possible, that if we don't do it, that when he gets to 1 year or so, that he's going to be packing his stool. Yeah, he will be stooling, but not everything will be coming out. That there will be plenty of stool in his stomach, and at the end of the day, they will bring out a colostomy. If you don't know what a colostomy means, a colostomy is a way of bringing out an intestine by the side of your stomach, so you can be able to put that if you're having problem with your anus, right? We're like, oh my God, no parents will want that for their child. And we said, okay, why not we wait for that time? They say, no, the best time is this. The doctor particularly said the best time to do this surgery is the first 1 month of his life, not realizing that this hospital is a new hospital and they just employed this doctor, and maybe, I don't know, I'm just thinking, that's what I'm thinking, he wanted to please the hospital, to show the hospital that he can do that. Anyways, you know, when Satan pull hand for person matter, we said okay. We went home, he was pulling, he was doing everything normally. After 1 month, we carried our baby by ourselves and went to the hospital to go and give to the doctor. So yeah, take, you say you go do the surgery, take. But I was wondering, a child that is just 1 month old, this surgery, I don't want to talk. So when we took the child for the surgery, after the surgery, there were complications all around. He had to use oxygen, he had an infection. Fast forward to, let me fast forward it. So the complication was so much that they said we should wait again. The day they discharged him, after they're supposed to discharge him a week after the surgery, but he stayed longer than that. The day they discharged him, I was just going home feeding him, but I noticed the child was not. I said, okay, maybe because he's just recovering. When we got home, I realized that the child, I was just touching the stomach. The child was just crying. I touched the stomach. I saw that there is a sweat on the stomach. We went back to the hospital. He was running temperature and all that. When we went back to the hospital, the doctor looked at him and was like, oh, what could be the issue? And at this point, it was not even passing stool again. It was just small things like watery stool that was coming out. And let me not even forget that people advised me not to do that surgery. So many nurses, so many people called me and said, this is normal for some children. Do not go for that surgery. But you know, when something is your first child and the doctor have already convinced you, even my parents told me not to do it, that there are so many children that are like that. This is our first kid, and the doctor have already complained. At the point, I was having my doubts. I told my husband, do we just leave this thing? Let's just allow this boy grow. He was like, you know, when God wants to intervene, he intervenes. I said, but this boy does not really have any problem. The only problem he has was no stooling, and now he can be able to stool. Can we just leave him? He said, everybody was confused. In short, I will not even blame my husband. I said, okay, let's go for a second opinion. We went for the second hospital they told us then, but the hospital is a federal hospital, so they didn't take us serious. We couldn't even see the doctor the day we went. So that was how we went back home. And the day we went for that hospital was on a Friday, and the surgery was supposed to be on Monday. We didn't have any choice than to go ahead with the surgery. After the surgery, all these things happened. We took him back to the hospital. That's same day, 24 hours after they discharged us. And the doctor was looking at the child. I said, okay, let him do a scan. He did a scan, and he said he cannot fathom, like he cannot place his hand on what is really wrong this time around. That the only solution is for us to sign a consent form that he will just go to the theater. This after doing scan did not show anything. We did x-ray did not show anything. There is nothing we did not do, but we know something is wrong because this child was crying and there is a swelling. The doctor said, okay, he will just take the child to the theater, open him up and just check around and know what is wrong. That was how we, life first, right? We allowed him, he went, but he said first of all he has to bring out a colostomy where the child can be pulling for, since the child cannot pull again. We said, okay, no problem. When he went, he opened up the child and he saw, I wish I can put up the picture, and he said he opened, if you see the opening is so wide under his navel, he said he saw a twisted intestine. The twisted intestine, he now cut off the twisted part, joined the other part, and that was it. He has already given this child a colostomy, and we are like, okay, can we just close up the colostomy? He said no, for now, that we are not going to close up the colostomy because we don't even know what is wrong. Okay, we've seen the solution, but let's just be sure that we should come back for the closure after 6 months. That was how we went home with our baby after he was on oxygen and all that. We went home back, and that was it. So he was growing normally, everything was going on well, there was no problem with this child. As at that 6 months later, he was already 9 months. He was starting to walk, learning how to walk. If he was learning how to talk, he can say grammar. If you say grammar, he will imitate you and say grammar. He was doing so many stuff, like growing normally. Then it was time for the closure, and because it was so uncomfortable bringing that thing out, there is no diaper we could not use. Normally we are supposed to be using a bag, and that bag was so expensive, not like we could not afford it, but we could not even see where to buy it safe. We decided to be using diaper since he's still a baby, and as at then the diaper can, at least he was still a child, then we used to buy oversized diaper like size 5, and that size 5 can get to his stomach and cover the stuff. So that's what we were doing. When he pull, we change the diaper. When he said growing, getting to 9 months, where he's supposed to wear that size 5 normally, what we do, we use one diaper, we place there, we wear him another diaper and wrap it. Like, we're just trying to manage, and it wasn't easy because we mind the kind of clothes he will wear. We must wear a pin-up clothes so that the pin-up can hold the diaper. Sometimes you just go out, the pool just leak there, you know, embarrassed. It was just a whole lot. So we really needed that surgery to be done, but we made a mistake. The mistake we made was not praying before going for this. We talked to our pastor, he said we can go, right? But we did not really pray. So each time we go for, it was during COVID now. Okay, they were still doing their COVID stuff. Each time we noticed something. Each time we go to the hospital for this surgery, he will have a temperature. They said, oh, they can't do this surgery with high temperature, which will take him back home. We'll bring him back home. When we get back home, he will be fine. There will be nothing wrong with him. In that 2 weeks, they will say, okay, it's that time they want to do the surgery. We'll take him back to the hospital. Once we get to the hospital, his temperature will get high. You see, using your instinct is very nice. If I remember this thing till tomorrow, I don't know if I can forgive myself, but I pray and I hope I can be able to forgive myself, because sometimes I just feel like we did this in ourselves. So instinct is very okay. So in anything you're doing, always listen to your instinct. It's very, very okay to listen to your instinct. So we were just trying. We did this more than 4 times. I lie you not, God knows, 4 good times. When we go to the hospital, temperature goes up. When we go home, temperature comes down. We said, this way no one do this thing. We were just laughing about it. This way no one do this thing. You go do ammo. We didn't even know it was just God that was preventing it. That's why each time I pray, I say, God, please forgive me. I did this myself. The 5th one, we're like, this thing is too much. And now he's getting to 10 months, Abby. We just need to do this. Okay, when we started was when he was 7 months. Remember, we did it at a month and they gave us 6 months plus. So he was already 7 months. So he did this thing continuously every 2 weeks until he get to 9 months. We were like, this guy, you're getting to a year. You must do this thing, right? All of us, we just forced him. The day we took him to that hospital, his temperature was high. We say, we don't mind him. When we stay, it will go down. And it happened. They say, admit us. When they admitted us, the next day, the temperature went down. We were like, okay, you guys can go ahead. When my husband was taking him to the theater, because my husband had to walk to the theater with them, he was just looking at him like this. That was the beginning of our problem right now. After the surgery was successful. We're happy, although it took longer than we thought. Now, let me tell you, the doctor made a mistake. Instead of, normally the colostomy is what we wanted to close and it's not supposed to take time. According to the doctor, because he has not been using his anus, he went to the theater and saw that the anus was tight, that he couldn't pull. He now went and did surgery on the anus. And now after doing surgery on the anus, are you not supposed to tell us, okay, take the child home, when this one heal, we cannot close the colostomy? But no, the devil, I don't blame the doctor, it's only the devil that I'm going to blame. The devil in him told him, okay, still close this. And he was pulling from, when you do a surgery, a new surgery, he was pulling from there. And when he came back, I was happy. I thank God. Well, they were looking at his temperature. It was skyrocketing. It was getting higher. That night I prayed. There's nothing I did not do. At the end of the day, he fell into the next day. It's that same day. He was using oxygen. He could not breathe well. Why? Because the poo, when he poo, because we were checking him, can he now poo? He can poo. But what happened? When he poo, part of the poo mixed with the blood and goes back to his body. And goes back to his bloodstream. That was how he had a sepsis. He had a sepsis and he went into coma after some days. After 2 days or 3 days, he went into coma. This coma is a blind coma, a coma that he doesn't even know what is going on. He cannot live, he cannot, hey Jesus Christ, he couldn't even do any type of breathing. There are different types of comas. People don't know. There are some you go into, at least you can do like 40%, the machine will do 60% for you. There are some you can do like 50-50, the machine will do 50, you do 50. But his own, he wasn't even doing anything, not even 1%, 0.1%. The whole thing was just flat. The machine was the one pumping his heartbeat. At a point, his kidney failed, his lung failed, everything in his body wasn't working, everything, because that's what sepsis does. It attacks your body. So the doctor, because he closed the colostomy, he said he was going to open it again, because he can't continue pulling from there, because the more he's pulling from there, the more the thing is going, their treating is getting worse. That was how he created another colostomy. They called it high risk surgery. They took him like that with the oxygen, everything. Thank God it was successful. He came back and that was it. Normally the doctor said he was going to stay 4 days, then he would start making an effort. After 4 days, he couldn't even make any effort. We waited 2 weeks. I think it was in 2 weeks time, at a point they were like, this boy, the doctors, they called me and my husband and said they are not sure this boy can survive this, that we should just try to buy our mind off the whole thing. We're like, okay, no problem. That was how we were like, I started praying. I called my pastor. He said, God, he said, God, he said, God, I thank you, God. Every day, if it's the second day he was in coma, he swore. If you see him swollen, and the worst part, you come and see him with tears. We didn't even know what, we cannot even imagine what this boy was going through. Anyways, let me fast forward to when after the doctors, they gave us that news. I prayed, I said, these people, they are just doctors, they are not God. This boy has a calling and he will survive. So some days later, he was able to be doing from 10%, 20, 30. He started doing 90. They said, okay, it's time to take it off so they can give him oxygen to complete the remaining 100. When they were about to take it off, he had the stress of taking that thing off. There was a bled in his brain, and it attacked the place that he was, his brain that's supposed to tell you you're supposed to breathe. So it attacked that part of brain. They put him back to coma. I was like, God, what is this? Well, after some days, let me just fast forward the whole thing. He was able to, they said, okay, he was doing some breathing by himself. They said, okay, it's time to take him out again. When they took him out, he was like this, already like a vegetable. He could not even raise his hand. He had a seizure, everything. The thing just killed his muscles, his body, everything. He was just like a vegetable, a proper vegetable. If you raise his hand, it will just fall like this. If you raise, at this point, he wasn't on coma again. He can breathe. He opened his eye. He can see what he can look, but I'm not sure he was seeing anything. Anyways, fast forward to the coma destroyed everything. There was blood. We're supposed to be doing physio. So when we got back home, when they discharged us, that was when a month later I took him for my second child. So we didn't have time to continue with his physiotherapy. We were doing the physiotherapy. He was able, then he lost his neck control. Like, he was just like a vegetable. He started getting his neck control. He started getting part of his body back. But because of the pregnancy, my husband always go to work. So I'm always the one that is supposed to be taking him for that physio. And it's very expensive calling them to come to the house. So the first trimester, all those things were just all over the place. So I didn't take the physiotherapy serious, and that was how we just left him. We were like, okay, maybe he can just do all these things by himself. And that is the biggest mistake we made. If we had continued with that stuff, with that physiotherapy, by now he should have even walked since. That was how we left him. 3 years later, he couldn't walk. 4 years later, he can't speak. Right now, by God's grace, at least he can walk, but he can't still talk. He still uses his diaper. There are so many things that are just so wrong. We are hoping for the best. We are hoping for the better. Now, how do I say this? People will look at him now and tell me, oh, did you take folic acid? Did you do this? Did you do? I will just look at them and be like, this is not a case of folic acid. It's not just right when you see someone's child like that, you say you want to blame the mother first. That's what they do. Once they see your child, they just want to blame you. Oh, maybe this person did not take her folic acid, maybe did not go for antenatal, maybe something. It's none of that. I gave birth to a normal child. H-pylori disease is not supposed to be, it doesn't affect the brain. It's just a disease of the intestine, like normal problem somebody can have. So normally the man told us he had been doing surgeries on H-pylori, and the children, they just get wet. When devil have interest in your matter and he sees opportunity, you just use it. That's what happened to our own, and it wasn't successful. All the surgery he has been doing have just been complication upon God. Now, did I even forget to mention that after 1 year plus, he was already getting to 2 years when we decided to put him back. That thing we didn't want to wait for, that impatience that was doing us. Now we had the patience way to wait. Even at that point, my husband was like, this boy needs to do so many things before we even do it. We had to this surgery did not even take up to 1 hour. His surgery, the putting in of that colostomy that brought this child to this level, did not even take up to 1 hour. Anyways, that's what happened to our child, and now we have our child also ourselves. Everybody looking at me like it's my fault. Everybody looking at me like, anyways, we are hoping for the better. So each time we tell anybody that this child went into coma and CCC, they even say he's doing better. That sometimes when a child goes into coma, it destroys them. Even an adult, when you go to coma and come out, you see that you're learning so many things afresh. You're learning how to do so many things. Some people even, there's a lady, I watch her testimony, 4 days in coma, she's learning how to talk again. She's learning how to walk. So you can imagine, talk more of a child that have not been able to do all those things. So it's just a whole lot. So that's what happened to my 4-year-old, and right now we have started therapy and we hope for the best. Now, according to the doctors, there is no known cause for H-pylori disease yet. Yeah, that's what they told us. It can just happen to any child, and not all children it happens to require surgery. Some just survive like that, but you just find out that maybe before you want to poo or something, it's always difficult for you to poo or for you to stool and all that. It is where we really pass through a lot, but we thank God. We just give glory to God. If not for God, this boy wouldn't have survived, because staying almost 2 months in coma and coming out and be able to be where you are right now, it can only be God, and we give God all the glory. You enjoy. Please, when you are told that your child have a H1 disease, do not panic. Just listen to your instincts and do the right thing. I'll see you again on my next video.